I guess everybody's in from outside, so I'm going to start out and say good evening, ladies and gentlemen.
Good evening.
Good evening.
Welcome to the Prostate Forum of Orange County. Let me open with a comment made by George Burns, the comedian, on his 80th birthday. When asked what he wanted for a birthday present, in George Burns' style, he said, "A paternity suit." Now, we all understand the humor of that today, but those of us in the prostate community can understand the demoralization of erectile dysfunction. My name is Russ Thomas, and I'm Assistant CEO of the Prostate Forum of Orange County, and I have the pleasure tonight of introducing, all the way from St. Louis, Missouri, Dr. Galen Bird and his wife, Linda. They will speak tonight on erectile dysfunction and incontinence and some of the solutions available. Dr. Bird is a veterinarian and practiced for over 39 years in a mobile house call practice. In 2002, Dr. Bird had a radical prostatectomy and all the side effects that come with it: incontinence and erectile dysfunction. His doctor didn't tell him about the probabilities of these side effects. Can you imagine that? He waited to 2 years to see if his condition might improve, but it never did. Thankfully, he found a solution to both conditions through restorative surgery. He chose a penile implant and a urological sphincter and sling as his final solution to his ED and incontinence problems. ED and incontinence are joint problems for both husband and wife. Linda and Galen tried many different alternatives. They tried pills, vacuum pumps, injections, penile injections, etc. And thanks to surgery, he found a solution to his problems. He has gone from anger, frustration, depression, to a fantastic life with these surgical repairs. Linda has been an active contributor to the Citizens for Roadside Safety after their daughter died in a blunt-end guardrail traffic accident. After the loss of their daughter, both Galen and Linda dedicated their lives to educating the public. They have appeared on numerous TV shows, including several appearances on Inside Edition. Their care for others and their honesty and frankness about their relationship has charmed audience across the nation. It is with great pleasure that I present to you tonight Dr. Galen Bird and his wife, Linda.
Thank you.
You're up, Doctor.
You're a tough act to follow. Well, Linda and I want to thank you all for coming. We're always excited when we get to share our experience with other prostate cancer survivors, and it's really exciting for us to be able to come down here to especially this warm weather. We've had a lot of snow in St. Louis, and it's great here, and we really appreciate it. I actually, like probably most of you, I had prostate cancer and developed ED and incontinence after my surgery. The treatments are all the same pretty much, even though it was caused by diabetes, heart problems, arterial problems, nerve damage, birth defects, injury, or about anything else. And Russ was telling you about I made a house calls, so I'm going to tell you one experience we had. I actually made house calls about the last 10 years I was in practice when I semi-retired, but Linda and I, we always worked together, so we had a young lady, about 35, call one day, and she talked to Linda, and she said, I'm going in the hospital for major surgery, so I'd like to get my dog spayed while I'm in the hospital. So Linda said, that'd be great. So I picked up the dog that morning, brought it back to the clinic and spayed it. Took it back that evening. Young kid said his wife did really well. So about 10 days, 2 weeks later, Linda knew I was working close to the house. So she called the young lady and said, could Dr. Bird come by and take stitches out? She said, oh, that'd really be great. So I got up and knock on the door, and usually they open the door and let me in, but a voice said, come in. So I walked in. Young lady was laying on a couch with a sheet over. So I turned around, opened my bag, got my stitch scissors. I turned back around. There she's laying stark naked with stitches all the way down. She says, Doc, how does this look? I said, well, it looks pretty darn good, but I'm the veterinarian. I went home and told Linda, and she didn't crack a smile. Couldn't understand it. Well, my story started about 10 years ago. I was going to my regular internist, and the last time I went in, Dr. Galen told me my cholesterol was sky high, and I need to go on cholesterol medicine. So we talked it over and decided, well, we'll just go down to the VA hospital, try and get the medicine a little bit cheaper. So fortunately, once I started on the cholesterol medicine, every 6 months they checked my liver functions, and luckily my PSA. So it was about I think about the fifth time I went in, the doctor looked over at the screen, and he told me, well, 6 months ago your PSA was 3.98. So we're going to go ahead and schedule a biopsy, but in the meantime we'll get another blood sample and see if your PSA has changed any. So it was about 2 weeks later, one of the nurses called, and she says, in the last 6 months, your PSA has jumped to 5.23, which was a little bit alarming to us. So they did a biopsy, and about another 2 or 3 weeks later, another nurse called, and she said, I have really good news for you. On the right side of your prostate, you're cancer-free. But she says, I have really bad news. On the left side, you have prostate cancer. I just figured, being in the medical field, we could surely find some way to get rid of the cancer. It really upset Linda. So we started reading. We read everything we could find on the internet. We bought books and read it. We talked to all of our friends that we knew that had prostate cancer, and any of the medical doctors we knew. So back then, we decided a radical prostatectomy would be the treatment of choice for me then. So we went ahead and scheduled the surgery, and after my surgery, my surgeon came up the room, and he says, I'm almost sure I got rid of all the cancer. He said, nerve spraying went really well. So he said, you shouldn't have any problems at all. So we're like, wow, this is great. But right after my surgery, not only did I have the ED, but I also had severe incontinence, which actually led to some depression for me. As far as the ED goes, we tried all the pills. Like you just heard, we tried several of the gimmicks, and actually nothing worked for me. We kept going to the doctor, and he said, well, wait another 6 months and try these things, and we'd keep trying the pills and a few other things. And I just failed time after time. I never did get an erection, and so I got where I felt like I couldn't even go to bat, because I know if I did, I'd strike out. So life was really getting hard for me from that standpoint. Also, I like to hunt, fish, play golf, play ping pong, and several other things. I got to the point where I couldn't even hardly do anything. I think the worst thing that happened to me, I got where I couldn't even hardly play with the grandkids. They'd come in and ask me to go out and play golf with them, or tennis, or go down and play ping pong, and I'd just make excuses, because I knew if I did, I'd be soaking wet. So finally one day, for the incontinence, I decided, well, I'm going to give up caffeine for 3 days and quit drinking coffee, which was a pretty big sacrifice back then. I'm getting kind of used to it now. So after 3 days, I didn't get a bit better. So finally, the third day, I went to Linda. I said, call the doctor's office and schedule surgery to have the ED and incontinence corrected. I told her I just couldn't live like this any longer. And besides that, our granddaughter back then was getting potty trained, so I was hoping I could become continent before she did. I think it's about 10 days after I had my surgery, we decided to drive about 100 miles out in the country and look at a motorhome for sale. And I told the owner I was moving a little bit slow yet because I just had surgery to correct problems left over from prostate cancer surgery. The owner is about 50. He says, well, I have prostate cancer now. He says, I'm not having any treatment because I have a new girlfriend, and I don't want to take a chance on either suffering from ED or incontinence. Well, we spent 10, 15 minutes looking at the motorhome, and the rest of the hour explaining to him that if he got treated and was unlucky enough to get one of these conditions, that he could be treated. It really amazed us that he was going to take a chance with his life rather than get treatment for the cancer. But we did talk him into getting some treatment. Now we're going to share some slides. Definition of ED is real easy, just inability to maintain erection firm enough to have sexual intercourse. There for a while I thought, well, there's probably not that many of us. Then later on I found out there's millions of people in America suffering, is this on? From some form of ED. One thing we find, if you're 30 years old, 30% have a problem, 50%, 60% for 60-year-olds, and right on up the line. And before Viagra came out, they thought most of the cause of ED was psychological, but now they know that most of it's physical, which makes it more easily treated. Frequency of intercourse, we got to make this a little bit fun. On a honeymoon, maybe 3 times a day, maybe more. 3rd decade, try weekly. And the 7th decade, try weekly. Different causes of ED. Almost everything gets around to the blood vessels or the nerves. The arteries going into the penis are like 1 to 2 millimeter. So that you get a little bit of plaque in there. It doesn't take much to interfere with the blood supply. So diabetes plays a big part, and it causes vascular and nervous problems. Different medications, some of the medications for depression and heart medications can cause ED. And of course, like testosterone and surgery. But one thing you don't have to do is live with ED, but it can be treated. Grandpa's complaining because Viagra is $10 a pill, and Grandma says that's only $40 a year. I find this slide very important. If you or one of your friends is suffering from ED, and it's not caused by radical prostatectomy like mine was, it can be an indicator that you might be in line for a heart attack within the next few months or up to 3 years. So if you know somebody like that, tell them to go see their cardiologist and get their heart checked, because you might save their life. Different treatment options, Viagra, Levitra, and Cialis. These are very similar. It's mainly the length of action of the pills that are different. Viagra, and you have to take them like an hour ahead of time and kind of watch what you eat and drink. I took Viagra and one of my friends took Viagra, and he got a headache, and he got a lot more than I did. But these work for a lot of people, and that is the first line of treatment. The vacuum erection devices we're going to talk about, injection therapy, suppositories, and penile prosthesis. With the oral medications, they're not effective like 30% of the cases. But if you've had a radical prostatectomy like me, they're not effective in over 60% of the cases. And of course, with the pills, you have to have sexual stimulation and watch when you take your pill and eat and so forth. And they can be very expensive. With the oral medications, sometimes they will cause headaches, splashing, runny nose, upset stomach. And if you take nitrates for your heart, you cannot take Viagra, Levitra, and Cialis because it might lower your blood pressure too much and can even cause death. With the vacuum pump, it's on the demand use, and the cost is mainly a one-time cost. It can be a little cumbersome, a little bit unromantic. If you use it a lot, it can cause even bruising and a little bit of pain. So you put this device over the penis, and it has an electric pump, and it sucks the blood into the penis. Then you snap this rubber band on, sort of, this ring, at the base of the penis. And this works very well for a lot of people, especially temporarily. It gives a little bit of a hingy effect, but it can work, and people a lot of times will use this while they're waiting for something better. Oh, looks like another Viagra overdose. With the injection therapy, you take like a diabetic needle, and you inject it directly into the side of the penis. And there again, this works for a lot of people. A lot of people aren't crazy about injecting their penis with a syringe and a needle, but for the ones that do, especially a lot of people with diabetes don't mind doing that. It can be effective. There's no side effects for the partner. And it can cause pain, and if you use a lot, scarring, and it can cause priapism, and that is if you have erection over 4 hours, you have to go to the emergency room. With Muse, this is a little pellet you put inside the urethra, and this usually isn't very effective, and it's very expensive. So the implants are ideal for people that have tried all the other treatments they want to try. They've been on the market for over 30 years. There's been well over 300,000 implants to date. The satisfaction rate with the implant is 93%. For us, it's 100. With the oral medications, around 50%, and with the injection, around 40%. What we find on these, after 2 years, the drop-off rate's real high, and not that many people are still using them. So this is the device I have. I have an older pump. I have to push 2 buttons to let it down. It's totally concealed. I can go in a locker room or any place, and nobody have any idea I had it. Feels completely natural to me and to Linda. It can expand the girth a little bit. And it is impregnated with antibiotics, and this has reduced the infection rate down less than 1%. So I have this reservoir in my abdomen filled with harmless saline solution. So it's not likely it would leak, but if it did leak, it's harmless. I have this pump in my scrotum, still have both my testicles, and I have a cylinder in each side of the penis. So when I want to have an erection, I just pump this, and every time I pump it, the penis just jumps, and pretty quick you got a nice firm erection, and once you pump it up, you can have erection for 10 minutes or 10 days, whatever you want. Linda doesn't recommend 10 days, but with the new pump, I have to push 2 buttons. You push this for about 3 seconds, and the fluid goes right back into the reservoir. And like I said, you have a nice flaccid penis, and nobody would have any idea you had the device if they saw you. Almost all the patients would recommend it to others, and almost all the partners would too. So this is a long-term solution. You can have an erection anytime you want. You don't have to worry about carrying anything with you. It's very spontaneous. And of course, it works as long as you want. You don't have any costly pills. So ED is a common problem. Almost every man can be successfully treated. And they're dependable. And it is a long-term solution. Before you'd want to have any surgery, you'd want to talk to a urologist that actually does this type of surgery, and talk to your partner, because you probably wouldn't want to go through the surgery if your partner wasn't interested. Whoops, that's an old one there. Now, we're going to talk about living life dry. This really changed my life. This is a little bit exaggeration the way I felt when I had the almost complete incontinence. I had to make fun of myself a little bit because it kind of drives you crazy either way. Do a little bit of anatomy. This is the bladder. This is the prostate, if anybody still has it. There's a sphincter here that the internal, if you have your prostate out, this one's usually destroyed or is destroyed. So everything relies on this external sphincter. So if it can't hold the urine or gets damaged, that's where we start getting our incontinence. Of course, we have the scrotum, testicle, and the penis. There's stress incontinence, there's urge incontinence, and there can be a mixture. Stress is, of course, if I'd hit a golf ball, I had stress incontinence, I'd just squirt. It was terrible. I couldn't do hardly anything. With the urge incontinence, you see people, they gotta go, can hardly make it to the bathroom, or a lot of times they'll have a combination of both. So what causes this? Radical prostatectomy, TERP, diabetes, multiple sclerosis, Parkinson, injury. We see young kids, 18 years old, have been in boat accidents or car accidents, come in with incontinence and ED. Then we see some very young kids that are born with spina bifida, and some of those are born with incontinence. With the incontinence, extra expenses, you have laundries, you have a lot of smell. I got rashes up and down my legs. If anybody's had severe incontinence, I'm sure they had those too. You lose a lot of sleep because I had to get up several times a night to change my pad and go to the bathroom. So treatment options, there's absorbent products, internal catheters, external catheters, collagen injections, and then surgical options. There's no FDA-approved medicine for stress incontinence. So here's the pads. If you use 2 pads a day, it might cost you around $600 and right on up the line. Plus, it's not a lot of fun. There's different clamps. This is a Cunningham clamp. I use one of those off and on. It's like having a clothespin on your penis. It's not a lot of fun. And you definitely don't want to leave it on overnight. But it is a non-medical solution. They're easy to use, and they're not very expensive. And here's a external catheter. It goes over the penis. Then you put like a bag on your leg. And it works fairly well if you don't mind doing that. The only problem is keeping it on sometimes. And with the anterior catheters, it's usually something you can't use very long because it very likely could cause an infection. With the carbon beads and the other injectables, they pass a catheter up through the urethra and inject this around the sphincter muscle to bulk it up. But these treatments are usually short-lived and don't last that long, and they have to be repeated several times. I think success rate's around 17%. So there's an advanced mill sling, which we're probably not going to show tonight. The advance is kind of taken over. Then a urinary sphincter. This is the material they use. The advanced sling is kind of copied off the female sling. We're not talking about the women tonight, but there's a sling for women. I've been told it takes 10 minutes to put in, and it's very effective. So this is the new advanced sling. It's been on the market about 4 or 5 years. This is good for people using about 2-3 pads a day. It's outpatient surgery, which means sometimes they keep you 23 hours for Medicare. And, of course, with any of these, you have to have a general anesthetic or a spinal. You have more rapid recovery with this and less pain than you would with the sphincter. And the advantage of this is that if you use this, you're continent immediately, where with the penile implant I just showed you and the sphincter I'm going to show you, you have to wait about 5 or 6 weeks to let them heal in before you can start using them. So this sling supports the upper part of the urethra and kind of brings it back up in position, puts a little bit of pressure on it. And like I said, it's been working very well for mild to moderate incontinence. You don't have any pumps or anything to use. This is the urinary sphincter. This is the one I have. I like the next slide better. So I have a second pump in my scrotum, both testicles, and I still don't know they're there unless I want to use it. I can still ride bicycles, horses, anything I want, and I've never had any problems with it. The surgery done on outpatient procedure. All these surgeries, if you have Medicare, it's about 23 hours. That usually keep you overnight. Almost all the patients would have this placed again, and almost all of them would recommend it to a friend. So I have a second pump with that harmless saline solution. I have a cuff around the urethra and the second pump. So this saline has high pressure, so it brings fluid around, fills that cuff, squeezes off my urethra just like my old sphincter did. And when I want to urinate, I pump this 3 or 4 times. It takes fluid out back into the reservoir, relaxes just like my old sphincter, so I can urinate. Then in a matter of seconds, about a minute, this comes right around and fills that cuff again to make me continent. And this has really changed my life. We're living on a little golf course now, and we play golf every chance we get. And I couldn't even hit a golf ball before. Also, I like to play table tennis. We live in an area where we meet and play about 5 hours a week, so it's been a lifesaver for me. I had both surgeries at the same time. Some of the doctors only do one, but since I needed both devices, I wanted to get the swelling and everything over with all at once, so that was the way I chose. This is the little sling they put in women, which I'm told takes about 5-10 minutes, and the success rate for women is over 90%. Now I'm going to turn this over to my better half, Linda, and she's going to tell you, I guess you heard a little bit why we're up here talking about this. And thank you very much.
Okay, Russ did tell you that basically why we got into helping other people and saving lives. It was just such a life-changing thing to lose a child. And we just decided, you can grieve the rest of your life or you can make a new life. And what we've basically done is making a new life. And part of that new life is we've become very passionate about helping other people. So that's why we're here tonight. And when Galen was diagnosed with his prostate cancer, I was amazed that he took it so calmly. I think if I got a cancer diagnosis, I would absolutely panic. But I guess as a veterinarian, he figured they'd just get that cancer out of him and he'd be fine. But we had lost his dad and my mom to cancer at that point. And I knew I couldn't lose another loved one, especially not my best friend and my partner for life. And so we did read everything we could possibly read about prostate cancer and the treatments and talk to as many people as we could and consult as many doctors as we could. And we did decide that the radical prostatectomy was the best treatment for him at the time. The robotic surgery was just kind of coming into the fore, and we knew that there wasn't anybody that had that much experience with it yet. So it's amazing that we just decided that, that was what we needed to do. And I know that a lot of you have been through that, and it is hard to make the decision on what you should do. But every time we meet a new fella, the first thing we ask him is, have you had your prostate exam and your PSA this year? And If they haven't, we tell them there's a telephone sitting right there and you go pick it up and you make that appointment. We actually lost my dad about 6 years ago to prostate cancer that spread to his bladder very quickly, just due to his decision not to have it treated. And it sure made us more thankful than ever that Galen chose immediate treatment for his cancer. Now, shortly after that surgery, that radical prostatectomy, as he told you, the disappointment and the frustration really started setting in. Of course, we were thrilled that he was alive, and we were thrilled that the doctor said that he thought he got all of his cancer. But at the same time, we were starting to deal with the side effects. He was suffering from ED and also severe incontinence. And we talked about it, and we said, we thought this could be a problem, but we had no clue. We thought it would take care of itself in time, and of course, it never did. In the first year, his doctor just kept telling him, try this, try this, try this, a bunch of the things that he showed you, and they didn't work. And even after that first year, he kept saying, just hang in there. You're going to keep getting better. I promise you're going to keep getting better. Well, that was pretty easy for him to say, but he wasn't the one going through the frustration and I think a little bit of anger and the depression that Galen was going through. But we just kept trying Viagra over and over and over again, praying every time it would work, and it never did. And all it did was add to his frustration level and further damage his ego. And also at this time, his incontinence just seemed to be getting worse. And he couldn't play golf anymore. And the guys would call him and say, come on, why aren't you playing golf with us anymore? And he just kept making up feeble excuses. And I thought, oh man, I can't believe they're believing what you're saying. But he says, I can't tell Harry I'm not going to go play golf today because if I hit a golf ball, I'll be soaking wet. He says, it's just too embarrassing. So one day they called him, and he said, I've had my Kegel exercise classes, which I don't think Galen mentioned tonight, but they're pelvic floor exercises. They're really more effective in women than they are in men. But he thought he was better. And so he said, I'm going to go try to play golf with my buddies today. So he put on his extra heavy pad, and he put there it went. He put on extra heavy jockey shorts, and he put extra pads in his pocket, and out the door he went. Well, he came home that afternoon a little bit sooner than I expected to see him, and I said, okay, you have a pretty sick look on your face. What in the world happened? He said, well, I'm soaking wet. I went through every pad I took, and I couldn't even go in the clubhouse and have a Coke with the fellows because I couldn't sit down on their upholstered chairs. So that day he gave up golf, and I did too. I couldn't see going out playing golf, having this great old time, and leaving him home alone, especially as depressed as he was getting. And I will admit to all of you that it was kind of a big sacrifice for me. I've played golf since I was 8. I told him when we met he might as well take up the game or he wouldn't see a whole lot of me. Both of our children played golf. And so we had played golf as a family for years. So at this point in our lives, we'd been married 35 years. We'd had a wonderful marriage, and we'd had a very satisfying sex life. And overnight, just like that, it's gone, as I'm sure a lot of you can identify with. And we had absolutely no clue that there was any other help for us because our doctor did not tell us that these prosthetic devices existed. But luckily, we were actually staying in a hotel where they were doing an educational seminar, kind of like we're doing tonight. And we saw a sign just posted in the hotel, and it said, treating problems after prostate cancer treatment. And we kind of looked at each other, and we ran to that door and asked if we could come in and listen. We didn't have any idea. And they said, sure, come on in. Well, the rest is history. That move changed our lives forever. But I will admit to you all that when we walked out of that talk, I turned to Galen and I said, I think we've just heard more propaganda about stuff that isn't going to help you. I mean, why would we believe that the devices that Galen showed you, the prosthetic devices, would work when everything our own doctor had told us about for 2.5 years hadn't worked? So we just went home and kind of dismissed it. But as the weeks and months went by and his frustration kept getting worse and his depression kept getting worse, that subject of corrective surgery just kept kind of coming up again and again. And I told him, I said, honey, you don't have to do this for me. I mean, to me, he was just as much of a man as he'd ever been. But he didn't see it that way. Guys just don't see it that way. And also, I couldn't imagine going through the pain of surgery to have sex. But if you've read the book, Why Men Don't Listen and Women Can't Read Maps, it says when a boy goes through puberty, he doesn't lose his skin sensitivity. It just all goes to one area. So, take that into consideration. And also the fact that Galen just wanted to be a normal man again. You know, how could I fault him for wanting to be normal, do everything a guy should be able to do, when all of my life as a polio survivor, I've fought to keep up with my friends and do everything they could do. So how did I have the right to say anything? But the one thing we knew was if he was going to have more surgery done, we were going to investigate somebody and find a doctor that was really good at it and had done quite a few of the procedures. Trust me, you don't want to go to somebody that does 1 or 2 of these a year. So we actually drove over 400 miles to have Galen's surgery done, and we are so, so glad that we did because he's had absolutely no problems. I can tell you that both of the devices that he has are just awesome. After waiting, I don't know if he mentioned tonight, you have to wait 6 weeks or approximately 6 weeks to activate the artificial urinary sphincter and the penile implant because they kind of have to heal in. And we were still both scared to death to have sex. I mean, his sex drive was at a rock bottom low just due to his inability to have an erection time after time after time for over 2.5 years. And I will admit the first time we tried the device was kind of a learning experience, but oh my gosh, this has gotten better and better ever since. He has his confidence back. I feel like I have my old husband back. And we have our spontaneity back, and I think that is such a big thing. You don't have to plan your low-fat meal and take your pill and wait, or you don't have to go to the refrigerator and get your injection or try to travel with it refrigerated, or you don't have to go to the closet shelf and get your vacuum erection device. Or we had a friend that tried to get through security with a vacuum erection device, and that just happened to be the day that they inspected his carry-on. And they held it up and said, "What is this thing?" He was mortified. So if you happen to have an artificial urinary sphincter or a sling or a penile implant, you can walk right through those detectors undetected. They don't have to wand you or anything like they do with hips and knees. So now when we're in the mood, all we do is just go to bed, pump it up, and off we go. It's wonderful. The artificial urinary sphincter is such a godsend. He's no longer dealing with those wet pads, the wet pants. I gave away every pair of light-colored pants he owned. And he had rashes, just terrible rashes. I'm no longer dealing with the odor of the laundry and the odor of the trash and the stains on the computer chair and the Jeep seat and just about anything else he chose to sit down on. But I think the greatest thing about that urinary sphincter is that he can play with our grandchildren again. It absolutely broke my heart to see him sit in a chair and watch me play with kids. But he is such a proud man. He loves those kids more than life itself, but he was not willing to go out and play ball, roughhouse on the floor, play golf or tennis or table tennis or anything because he knew he would be soaking wet and he would embarrass himself in front of the kids. So those of you that are here tonight are really here because you're doing the right thing and you're learning, you're getting informed. You know, it's kind of like the saying goes, those who know the most do the best. And you need to take that knowledge and you need to make a decision whether you really want to get some help. We waited actually 9 months after we heard a talk kind of like this before we got ourselves help, and now we look back on it and wish we'd gone in the next day and hadn't wasted another 9 months of our life. But, you know, if you don't go in and talk to a doctor, you're never going to know what will help you. You need to put it out there on the table and discuss it with them and find out what will help you, because just about everybody in this room can be helped. So with that, we have asked Dr. Marinelli to come tonight to do question and answer with us. And I know that you all like to have a nice long Q&A. And then we'll also be here one-on-one afterward to answer questions. Also, Russ has, not
Harry.
So Harry has cards.
Grant, oh, I'm lying.
Cards and pencils.
Yeah. We generally hand the mic to people for question and answer, as you're well aware. But tonight, due to the sensitivity of the subject, we have pencils and paper over here that you can come up and fill out a question, then go back to your seat, and nobody's going to know who's asking what question, just for your own privacy. Who has, Harry? Okay, there we are, over there.
And actually,
you're welcome to hold your
you're
hand up.
certainly welcome to hold your hand up.
Yeah, you don't have to
know.
come up, yeah.
We're all in this together, and we've heard it all, and we want to help people. So, Dr. Marinelli, do you want to come on up? You can tell them a little bit about yourself, too, if you'd like.
Yeah, I'm sorry I didn't get a preview of Dr. Marinelli there. I do want to make one comment. I'm going to hand him the mic here. I'd like to make one comment. 99% of the time that we have a speaker here, we have a male speaker. And Galen, you did a good job at giving some background. But the woman's perspective on this was terrific tonight. I learned things I never knew from the lady of the house. So, thank you very much.
Thank you.
Derek Marinelli. I'm a urologist. I've been practicing for almost 21 years. I work at St. Jude Hospital here and also Placentia Hospital. I've been doing this for a long time, and I do all the typical urologic surgeries. I do the radical prostatectomy and also the robotic prostatectomy. And I like to say that I kind of specialize in these type of treatments, both the artificial urinary sphincter and the inflatable prosthesis. Do a lot of these presentations, but I think this special perspective on it is amazing. I've never heard this presentation before, and it brought to light a lot of things that I did not mention that should be mentioned. So I want to thank them very much. They did an excellent job. So today I'm just here to answer any questions, go through any concerns that you have.
One right here.
And we'll go from there.
Here's one
Yes.
right over here.
Yes, sir.
I have a predecessor to the questions you expect. I was taken by, because we do a lot of information work ourselves. Our mission here is information. And I was taken by the fact that at the very beginning, you were offered a diagnosis on the phone, as opposed to a briefing, and perhaps not given all the information that they might have given you. Have you, out of that part of the experience, have you any lessons for us on how maybe to better interact with one's physician, or questions to ask, or?
Yeah.
Probably need the microphone.
No, I'm fine.
Okay.
Okay.
Well, I don't know if you can hear this, but in my perspective, this is a real sensitive situation. Can anybody hear me? You got it? Almost. I'll talk real loud. It's a real sensitive situation and we really treat it
Very specially. Anybody that goes through this is seen, or anybody that comes to my office for an elevated PSA level or any concerns about prostate cancer is seen by the doctor. They're talked to by the doctor. The doctor does the biopsy himself. Everybody comes back to my office to get the results, and we sit down and talk whether they're positive or negative. If they are diagnosed with prostate cancer, they usually go through about a 45-minute consultation with the doctor as soon as they get the results. I have a lot of literature that I give the patient, and then I make them another appointment to come see me in a week. Usually I recommend that they bring the spouse with them, and we go over all the different treatment options. We do a lot of radiation therapy. We do a lot of radiation seeds, and also the surgeries, both the open procedure and the robotic prostatectomy. And I assure you that everybody is well informed when they come to my office about the possible complications, the success rates, and all the alternatives to prostate cancer. So I'm not sure how things were done 10 years ago, but nowadays we're very sensitive with things like this. We have support groups. We have oncological assistants from St. Jude Hospital that follow up with the patient, make sure that all the questions are answered, and they're all plugged into the system. So I've never really had a complaint about not being informed about their disease.
Yes. Is this working? Yep. In Orange County, I know there are some physicians that are prescribing Cymbalta for mild incontinence as an off-label prescription. I worry a little bit about whether that's too powerful a drug to use for an off-label use. I was wondering what your thoughts were about that. It does seem to be effective.
There's one clinical trial coming out that is looking into this. It's as far as the results that I've seen from them, it's not been very effective. And I think it's, it works on patients, depression and things like this, but it's really not affecting the actual problem in incontinence. And I will not use anything that's off-label unless it's been tested thoroughly.
Larry, I know you have a question, but what I need to do is eventually I need to have one of our staff members go through and pick up any of these cards. I guess I can do that while you're answering your question. Answer.
Thank you for a great presentation here today. Two-part question. First one is, I noticed on your presentation chart, the pie chart, you gave different causes for rectal dysfunction. Yeah, okay, thank you. Can you hear me now? Yeah. Sorry about that. I noticed that you didn't have radiation as a cause to ED. Is it because it's rare, or it's Is there? Okay. I didn't see. Yeah, no problem. The second question is there any remedy, or is there any way that you can minimize the effect of radiation therapy on the nerve?
No, there is not, and it's very difficult to predict who is going to get erectile dysfunction after radiation therapy. We do know that more extensive disease, if it's outside of the prostate gland, has a much higher or lower success rate as far as erectile dysfunction goes. So, no, there is no predictor of who will or who won't, but we do know it is something that can happen after radiation therapy, and it's pretty prominent after radiation therapy also. So I can say that it's something that, depending on the extent of the disease.
Would that condition minimize the effectiveness of a penile implant?
Yeah, well, this is a good question. Okay, can you have an implant if you've had radiation therapy?
Yeah.
Okay,
Thank
that's
you.
a very good question. You guys need to understand this. 10 years ago, 15 years ago, if you're not real experienced at doing these procedures, we're worried about the radiation therapy causing problems with the healing process in that area. And so there's a lot of urologists that will shy away from doing those kind of procedures in radiation therapy patients. We've become more and more experienced with this and have been taking on more and more patients with radiation therapy and have had a very good success rate. We always worry about this either with the sphincter or the prosthesis, and you will find some urologists that will not do these procedures on radiation therapy patients. I'm very picky on who I do them with because I want to make sure I get a very good result, but we will find you somebody if we're very worried about the extent of the radiation therapy. So I would say it's not ruled out that you can have one of these if you've had radiation therapy.
Final question. How would a doctor know that a patient is a good candidate for that type of procedure?
It has a lot to do with the amount of radiation therapy you had, what we call the portals, or how wide they had to go to the extent of the radiation, how far they had to go out. And also there's a lot of, on your physical examination, you can feel some patients are very what we call indurated, or it's very firm in the area where we're going to put the prostate, or where we put the prosthesis. If that's the situation, we may shy away from it.
I have a couple of questions that I've gathered from the audience, Doctor. This person says, I've had hormone blockade, and if you still have your prostate, but you have zero libido, which is a result of hormone blockade, and genital shrinkage of 35%, are the solutions still the same as radical prostatectomy?
Yes. Well, this is something that I want to, I sit down with the patient and discuss it in great detail with them, because a lot of these patients will have a low libido. What happens is with hormonal therapy, basically prostate cancer is fed by the male hormone testosterone. And what the hormone therapy does is take away the testosterone. It actually suppresses it to very, very low levels. This will actually find that the prostate cancer will shrink. Your PSA will drop. Everything will go the right way, but it's taking away the testosterone level, so you don't have that sexual drive. Some people do, and some people have no problems with trying sex, and sometimes they'll accomplish it, and other times they won't. I don't think it's a contraindication to do a prosthesis in these patients. If you're motivated to have it done, if you want a penile prosthesis, that's all it will take.
Next question. Does the man experience an orgasm with an implant device?
Yeah, I have the same orgasm I ever have. The nerves are on the outside of the penis, so I have the same feeling, and it's no different except I have my prostate out, I don't ejaculate. And you want the women's side of it?
Absolutely.
I cannot tell that he's had a penile implant. You can't tell by looking at him. You can go in the locker room or anything. And also the feel during intercourse is just the same as it was before he had his prostatectomy. So, And the great thing is it stays erect as long as you want it.
Okay. Next question. Does Medicare cover the costs of these operations?
Yes, Medicare will cover this procedure. Most insurances will cover this procedure, especially the sphincter. I haven't had any problems with the sphincter. There's just a few insurance companies that will have a problem with the prosthesis. They'll make sure that we've gone through all the non-surgical ways of getting an erection first, and then usually they'll say it's okay. So I don't think it's a real problem with the insurance.
Okay, the next question. Of the 3 pills, which one is the one to start with?
It's different for every patient. In younger patients, I prefer the Cialis. The Cialis is the one that gives you a longer window of time when you can use it. Viagra and Levitra usually will work within about a 6 to 12 hour window. Cialis will work, they say, for 36 hours. The problem with that is that you have side effects from this medication. You have a flushing in the face, you get a little bit of a headache, and with the Cialis, that will last 36 hours also. Whereas the Viagra and Levitra, it's a short period, it's out of your body, you don't feel these side effects. So for every person, it's different, and we adjust it, we adjust the dosage and the type depending on the patient.
I don't have any more written questions here, but I would like to go back and address one of these questions personally, if you don't mind, if you'll indulge me a minute. The first one that says, if you still have your prostate, i.e., if you've had radiation treatment, will these implants still work? I had proton treatment at Loma Linda, and my libido never recovered, and my ability to have an erection never recovered. So I had the implant. Now, even though I didn't have a great libido, I still wanted to be close to my wife. I still enjoyed the sexual activity, even though I didn't fantasize about it. I could go watch TV and not think about it, but I wanted the closeness with my wife. And so, yes, the devices work just as well, whether you have your prostate or not, whether you have libido or not, and if you have shrinkage. Incidentally, speaking of shrinkage, that's something that the doctors don't normally tell you, but there's generally between a half an inch to 2 inches of shrinkage in the penis, no matter what treatment you have, because you can have the operation that, for whatever reason, shrinks your penis. Hormone treatment, by definition, will shrink your penis. Radiation treatment will do it. So you're going to have, he says 35% shrinkage. That seems to be a lot, but not out of line. And there's no effect with these devices. These devices will work regardless of any of this.
Oh, okay, yeah. About the prosthesis and the size. Again, every patient is different. When we do the surgery itself, every penis is measured. It's measured from the inside. What we do is the 2 cylinders that are in the penis that give you the erection, those are the cylinders that are measured when we get in there to do the procedure. So every prosthesis, every size is different according to the patient. And we specifically measure that penis during the procedure. It's really the entire cylinder that we measure. Only half of it is the actual penis. The other half is deep down in the body. So we measure that entire distance to put the prosthesis in. The prosthesis will not make your penis any larger, okay? And I make sure that patients understand that. It can increase the girth of the penis, but it will not make it any larger or longer. Okay? Yes? You never have to change it. It's an enclosed system.
It doesn't leak or leach out in any way. I have patients that have had them for 20 years, and there's still the same amount of fluid that's in there.
Doctor, you stressed earlier that the various pills are contraindicated for those patients on nitrates or whatever. What about the suppository? Is it the same mechanism?
No, it's a completely different mechanism, and it's not contraindicated in those patients.
So those heart patients can use that if it's effective for them.
Exactly.
If the implants didn't work, that it doesn't seem to work, can you have it removed? And if you do, are there side effects to doing that?
Basically, there are a few reasons why prosthesis will not work. Basically, the one is if it ever gets infected. It is a foreign body in the body, so that if it ever gets infected, you do have to remove it. There were problems with malfunction of these after years and years where the valves would break or something where you'd have to replace it. It was probably in the range of about 7% of men. 7 in 100 of them would have to be replaced for malfunction problems. And yes, in any of those situations, they can be removed and either another one put in right away. If it's a malfunction problem, if it's an infection, we take it out. There are no side effects to that, taking it out, but obviously you will not be able to get a normal erection, nor will any of the medications or medical managements be successful.
Any other questions this evening? We got one in the back. Let me take the mic back to you so that we can get loud feed.
I was just curious, what is a normal or average testosterone level?
There is a wide range for that. It's anything between 300, a total testosterone level is anything between 300 and 877. It does fluctuate throughout the day, and it is there are different levels depending on your age also that are acceptable.
If anybody knows that the best time to have sex for your testosterone level is 7 o'clock in the morning.
Yes, sir.
I'm just curious what happens if you have one of these urinary tract systems put in and you get knocked out and nobody knows it. Does your bladder continue filling up and up and up?
I wear a band, but mine isn't for repair. But I wear a medical alert.
Okay.
The question Murray asked over here is, do you need a medical alert for the erectile pump?
Yeah. Let me tell you a little bit about why you would need something like that. And all my patients do get a medical alert band. Because the sphincter is always closed. Okay, and that's the normal position of it, is to be closed like that, so no urine can get out. Well, the problem is if you go into an emergency room or something and they have to place a Foley catheter, they have to get by that area. A lot of even doctors in the emergency room will not know what one is and try and force a Foley catheter through this sphincter that's closed. And it can develop a problem. It can erode the urethra. It can cause problems with the urethra itself. We do have a way of deactivating the sphincter, so we can actually open it up and keep it open. There's a button on there that you can actually push that will do that. But people have to, the emergency room has to know that. So we put an armband on everybody, and anybody that has a sphincter or a spouse or anybody that knows says, before you do anything urological, please talk to a urologist. It doesn't have to be the one that put it in. All urologists know what to do.
Yes, sir. Here we go.
Dr. Monelli, I believe. What is the approximate cost of that procedure of implant?
That I don't know. I cannot tell you the exact cost. Why? Because there's a surgeon's cost, there's an anesthesiologist's cost, there's an operating room cost, there's the cost of the prosthesis. There's a lot of things that go into the cost, and a lot of people ask me about that. Well, you know, what would it cost to have something put in? It's very hard to say. I mean, I know that, you know, I don't even know the prosthesis is probably about $3,000 or $4,000. And is $85,000 or $8,500? The operating room, the staff, everything. It's an expensive thing. But again, these are all covered by your insurance.
All right. Any other questions? We would like to thank Dr. Bird and his wife, Linda, and, excuse me, Dr. Bird, but particularly your wife, Linda, for coming out to, and our urologist, you have cards or something of people? What do you mean think? You can't come to a meeting without cards. Okay, well, the Birds, I think, will be available around for more private questions if you had for a little while. All three of you will be around for a little while. And we'd like to thank all of you for coming out tonight. We appreciate your attendance. We appreciate you sharing with us. And next month, we're going to have a sharing meeting where we're going to have 6 tables, and everybody can come out and discuss their specific problem with the people in those particular tables, and we will have a moderator at each table to discuss your specific problem and help with people helping people. So come on out next month. Thank you for coming out tonight, and enjoy the rest of the evening.